Monday Morning House Calls, sponsored by Appalachian Regional Healthcare.
Welcome back inside Mountain News this morning. Today we're being joined by Judy Craft and Patricia Smith. Thank you so much for joining us. You're here with Hazard ARH, and you guys work in the operating room. Today we're talking about preparing for surgery, because it takes a lot of preparations before then to make sure that surgery goes smoothly for whatever type of procedure that you might need. Now, when you're scheduled to have surgery, usually there's an appointment that, you meet with the doctor and they explain to you what's going on. So, Patricia, can you kind of explain to me what happens in that pre-op appointment?
The physician will probably explain what procedure he or she wants to perform, explain all the benefits and why you need the surgery, and just give you a fully informed information on what you're going to have done. You may or may not be asked to sign an informed consent at that time, at which you will read over all the information given and sign consent that the procedure can be performed. Just at that time, make sure if you have any questions or do not understand the information, you ask, and that way the doctor can explain a little more information to you.
And usually it's good to know, or good to give the doctor as much information as you can, like medications that you might be on, both prescription and over the counter, right?
Exactly, because the physician is going to tell you the night before surgery what medications you should take, what medications you should not take after you are not eating or drinking. Some people are diabetics, and if they take insulin and they haven't been eating all night, the doctor may not want them to take the insulin that morning. However, on the other hand, they may be a patient who has high blood pressure, and they may need to take that blood pressure medication that morning before surgery. So he or she will indicate specific instructions on what you should or should not take.
Okay, and so the day of surgery, Judy, what are some things that you should do the day of surgery?
Depending upon the procedure, you may be given some special instructions for the night before for bathing, and then again the morning of. Also, it'd be important to bring a list of medications with you to the hospital. That just ensures accuracy of the medications and if there would be any interactions with anesthesia that you may be given. It's also good to have a driver come along with you, somebody that's responsible, will care for you immediately after, and that's really all.
Just kind of do that. Now, after the surgery, immediately after, and even when you go home, what are some things, Patricia, that you should do right after surgery?
Well, right after surgery, before you're discharged, you need to make sure that you ask any questions that you're not sure about. The nurse who's discharging you will give you follow-up appointment information about any medication changes or new medications that have been added to your list. They will explain to you how the physician wants you to care for your surgical site area, skin care and bathing and so forth, and any return to work. But it may be a good idea to have some questions ready before you go to surgery that you can ask after surgery before you go home.
So basically, in all of this, whenever preparing for any type of surgery, communication is key with your doctor or maybe his or her nurse, right?
Exactly, yes.
All righty. Well, thank you guys so much for joining
welcome.
us this morning.
Thank you.
And Chef Walter is next.